Hello everyone, welcome to MBBS Hub. Okay, now we are going to our first class, General Pharmacology. In General Pharmacology, we will see about the definitions and what are the types. Okay, it's just an introduction. Okay, guys, let's move on to the lecture. Okay, first, pharmacology. It is a science of drugs or study of the drugs. For simple terms, we will call it as study of drugs. Okay, pharmacology has two types, mainly pharmacodynamics and pharmacokinetics. Okay, now we go into the pharmacodynamics. Pharmacodynamics means what drug does to the body. Okay, that means if we take a medicine or if we take a drug, what is the action of the drug to the body after the taking, what drug does to the body. So that is known as pharmacodynamics. Pharmacodynamics include three. So first one in that physiological effect of drug. Second one, biochemical effect of one biochemical effect of drug. And third one, mechanism of action at organ system. Means what is the physiological effect of the drug and the biochemical effects of the drug and the mechanism of action at organ system, and how it acts on the what is the mechanism and the organ system. So these three things includes in the pharmacodynamics. Okay, then we move on to the pharmacokinetics. Pharmacokinetics means what body does to the drug. Means if we take a drug, then how does our body reacts, that is known as pharmacokinetics. అంటే ఇప్పుడు మనం ఒక డ్రగ్ తీసుకున్నాం, ఆ డ్రగ్ని మన బాడీ ఏం చేస్తుంది, సో దాన్ని మనం ఏమంటాం అంటే ఫార్మకోకినెటిక్స్ అని అంటాం అనమాట. జనరల్లీ ఫార్మకోకినెటిక్స్లో generally there are five types of actions in the pharmacokinetics. First one, absorption. If we take a drug, first it is absorbed and then binding or storage will be done. After that storage, it will be distributed to the specific and what is the action of it, and then it is will go on into biotransformation, and finally excretion will be done. So we have to remember four things. First, absorption. Next, metabolism. And then okay, this is absorption 1, this is 3, distribution is second one, and 4 finally this is excretion. Okay, absorption, distribution, metabolism, excretion, these things should be remembered. And when a definition of the pharmacokinetics is asked in the Viva, you should tell the definition and you should also tell the four things. Okay, then we move on to the next definition, pharmacotherapeutics. Pharmacotherapeutics is about the knowledge of disease, having knowledge about the disease. If for example, if we take fever, generally what we prescribe, generally we will prescribe paracetamol. Okay, 600 mg, 600 mg, 650 mg, 500 mg, like children, small dose. For adult it is the dose will be increased. Okay, and how many times it should be taken, dosage. So having knowledge about the particular disease is known as a pharmacotherapeutics. Okay, then we move on to the next definition. Clinical pharmacology. Clinical pharmacology means study of drugs in a man. Okay, study of drugs in a man is called as clinical pharmacology. It includes both pharmacodynamics and pharmacokinetics. What body, what drug does to the body, and what body does to the drug. Okay, in this evaluation of efficacy and safety of drugs, its main aim is to generate data for optimum use of drugs and practice of evidence-based medicine. The drug should be in optimum usage and it should be legally approved and it should be very useful with less side effects. Okay, next, chemotherapy. We will hear about the chemotherapy in cancer treatments. We will listen that time. Okay, coming to that, it is a treatment of systemic infection or malignancy with specific drug that has toxicity to kill parasites or disease causing organism with no or minimal effect on host. Means if we take a drug, okay, for example, take a disease, it is a parasite. Okay, take human, take him as a host. Okay, if a disease is acting on a human, okay, if that means a parasite is living in the host. Okay, if we take a drug, then the drug toxicity should kill the disease. Okay, but there should be no or minimal effects of the drug for the host. Okay, there should be more, there should not be more side effects of the drug. Then the drug is very useful to the human. Okay, that is called as chemotherapy. Then coming to toxicology. Toxicology, it is a study of poisonous effect of drugs and other chemicals. We already know what means toxicology. What is toxicology means? It is a study of poisonous effects of drugs and other chemicals. Okay, it is used for the detection, prevention and treatment of poisoning. Okay, it should used for the detection, prevention and treatment of poisoning. Then coming to the next, pharmacoepidemiology. It is a study of interaction between drug and humans. Okay, what is it? Study of interaction between drug and humans is called as pharmacoepidemiology. అంటే ఒక హ్యూమన్కి ఒక డ్రగ్కి మధ్యలో ఉండే ఒక ఇంటరాక్షన్నే ఫార్మకో ఎపిడమాలజీ అంటాం అనమాట. ఇట్ టెల్స్ అబౌట్ ది బెనిఫిట్స్ అండ్ రిస్క్స్ ఆఫ్ ది డ్రగ్. ఇప్పుడు నువ్వు ఒక డ్రగ్ తీసుకుంటే ఒక డ్రగ్ యొక్క సైడ్ ఎఫెక్ట్స్ ఏంటి, హౌ ఈజ్ ఇట్ వర్కింగ్, అంటే ఇది బాగా పనిచేస్తుందో లేదో, ఓకే ఇట్ ఈస్ కాస్ట్ ఎఫిషియంట్ ఆర్ హౌ ఇట్ ఈస్ వర్కింగ్ అని చెప్పనమాట. అంటే దీనికి ఇట్ హ్యాస్ మోర్ సైడ్ ఎఫెక్ట్స్ ఆర్ నాట్ ఆర్ లెస్. సో దట్ ఈస్ కాల్డ్ యాజ్ ఫార్మకో ఎపిడమాలజీ. దెన్ కమింగ్ టు ది నెక్స్ట్ టాపిక్, డ్రగ్ నామన్క్లేచర్. Drug nomenclature has generally a drug has three names. One, chemical name, non-proprietary name, and then proprietary or brand name. Okay, this topic we will discuss about this in the next video, and in that video about drug nomenclature, and there will be some drug compendia topic will be included, and essential medicine concept list, essential medicines list that will be there. If we have any doubts or if we have any problem in understanding or any other doubts, you can comment in the comment box, and please like, share and subscribe to your friends. And tomorrow pathology video will be, introduction to pathology will be uploaded. Okay guys.